there, you're with BloombergQuint. The sudden lockdown imposed in the wake of COVID-19 posed both a challenge and opportunity for India's health startups. Restricted access to diagnostic centers meant more patients embraced online consults and solutions. But limited imports meant broken supply chains that led to prices of raw materials in the domestic markets to skyrocket. So, how has India's health startup ecosystem coped with these challenges and stepped up their game? In this special series on Bloomberg Quint, we are speaking to businesses to understand how India's health market has evolved in the last few months and where do we go from here. My first guest today is Gautam Chopra, founder of BeatO, and the reason he found BeatO was a personal one. A diabetic himself, Gautam, with his co-founder Yash Sehgal, set up BeatO in 2015 as a one-stop platform for patients to track their and manage their blood glucose levels. Gautam, welcome to Bloomberg Quint. If I understand correctly, Gautam, you sell a device which is a glucometer, which is a device to measure blood glucose levels, which when plugged into a smartphone that has your app, helps diabetic patients manage their sugar levels. Could you briefly explain how diabetic patients can manage their condition through your app?
Sure. Thanks, Payaswini, for having me over. Yes, as you said, we look at condition management for people with diabetes and the interaction of several people who are diabetic starts with us through our IoT-based devices. So these are these small miniature sugar monitoring devices that simply plug into your smartphone. And when you take a blood glucose reading, it straight away reflects on the app. It's also on the cloud. And since there is information and data of the individual on a single platform, we're able to actually provide real-time support based on a person's trends or his data in order to be intervene in the correct manner. So this could be through personalized nudging that we provide on the platform, could be through a set of diabetes educators, as well as through doctors and endocrinologists. So we have a sort of an AI-driven triaging system through which we understand the needs of a person and accordingly intervene at the right time with the right action. So that's basically what the overall platform is about. And of course, then, getting into other full life cycle management of an individual through a set of services as well.
Okay, Gautam, we've been told that patients with pre-existing conditions like diabetes, blood pressure, asthma are at a higher risk of contracting COVID-19. You claim to have about 100,000 diabetic patients on your platform. What are some of the trends you've seen since the start of lockdown to now, based on the data that has come to your platform?
Right. So it's pretty interesting. I think just to quickly correct, I think it's not about a person with an underlying condition, his or her risk of contracting a condition like COVID. It's simply that when a person is infected with a condition like COVID, given the fact that they may have an underlying condition that like diabetes, their immune system is already weakened, right? Yeah. As a result of that, the risk of mortality in people with diabetes is about 3 or 4 times higher than a regular healthier human being who may have got COVID. More importantly, also that it takes longer time to heal a body of a person with diabetes. So you would on average see about 25 to 30% longer length of stay of these individuals in hospitals, which can also prove to be fatal, right? Because the risk of complications getting developed during that time frame also increases. So naturally, a person with diabetes is far more vulnerable to the adverse outcome of an event like COVID, and it becomes extremely important for people, including myself, whose sugar levels might be uncontrolled, to be able to especially manage their sugar levels and bring them under controlled range during this period. Of course, very interestingly, what we noticed, and like you mentioned, we have several thousands of people monitoring on a daily basis on our platform. Very interesting trends came out when we look at the last 8 to 10 weeks of data of our population. We find that naturally when a person is monitoring their sugar levels, there are various factors that impact a person's sugar levels or blood glucose levels, right? And stress and anxiety is one of them. So what we find is that in the initial days of COVID, which would be perhaps the first 3 or 4 weeks of March, we found that people who were otherwise in perfect glycemic control, which is in their normal sugar level, attaining normal sugar levels, their sugar levels actually started to rise, and we found almost about 10% of our population who was otherwise in normal perfect glycemic control actually went out of range, and their sugar levels spiked by about 35 to 40%, which was very abnormal. And one could, of course, contribute this impact because of not only stress and anxiety, but also perhaps during the initial phase of COVID as well as lockdown. Like you said, there was disruption of supplies. People could not go to doctors and specialists to be able to follow up. Medicine supplies were also difficult to obtain, strips and so on and so forth. So we found that a large portion of this population to be largely uncontrolled. Very interestingly, of course, over the last 4 weeks of May, obviously, we also implemented a lot more education during this time through our intervention systems. Made sure that we had doctors and endocrinologists added to the system who could sort of cater to the needs of people who really needed an intervention by a doctor. And we found that over the last 4 weeks, we have actually managed to bring everybody who had gone in an uncontrolled glycemic state back into the normal perfect glycemic control state. So which is really heartening to see, because we are seeing interesting and new trends. People are, or patients themselves are adopting technology like never before. Our engagement parameters across the board, whether this be in retention and monitoring frequency, you name it, are all up by about 30 to 40%. Even on the partner side, whether this be the doctors themselves, I think the level of adoption and embracing technology has increased many folds, which I feel what we may have thought after a few years would take place because of COVID. Looking at the glass is half full. It's actually come much sooner and much faster.
Okay. Gautam, the WHO has released a survey of about 155 countries, which essentially says that services for non-communicable diseases has been seriously disrupted as a result of COVID. We've seen that happen in India as well. Reaching a diagnostic center is a challenge. A lot of them were shut for lack of staff. Screenings and in-person consultations with doctors have been put on hold. Has that translated in terms of numbers into more patients embracing digital products like yours, and also for a diabetic to be able to even trust the level, to have that trust in a platform like yours, has that you've seen that faith coming in? Because I was looking at some of the reviews of your app on on iStore and Google Play. Probably these are patients who traditionally gotten tests done at a diagnostic center and have come back to say that oh, the result is not reliable. What I got at a diagnostic center and the level that the app is showing me is hugely varied. What have you done to develop this inherent trust that patients have in digital platforms?
Right. So I think I'll answer I'll take the question in two parts. So the first one being, certain states, especially where you would find low and low middle ETL, epidemiological, tier level. We find very interestingly, these states are actually the ones where, states like Rajasthan, Bihar, UP as well. The incidence of diabetes in the recent years has been on the highest rise, right? And unfortunately, many of these states in India are not as well equipped anyway to handle non-communicable diseases. And in events like COVID, where we also find in our data set, that there are people from these states predominantly who are diabetic, and the data and the sugar levels have actually substantially gone high. It becomes a significantly grave problem, because they are in a place where, in any case, non-communicable diseases are not handled, or as well handled perhaps in places like Mumbai or in Delhi and so on and so forth. And hence the digital reach becomes even more important for these individuals, right? Because when you look at the healthcare infrastructure, the physical healthcare infrastructure, it's pretty much concentrated in the top few cities in India as far as non-communicable diseases are concerned. So platforms, any platform that allows an engagement and interaction of people who are, as far out in Jammu Kashmir, or perhaps in more interior parts of our country, to be able to reach them and to be able to rightly sort of intervene at the right time, at the right moment, with the right information, becomes even more critical.
Sure.
And during this phase, we've actually seen a far higher adoption of the platform or digital platforms when you talk to even other, health tech startups, by tier one and tier folks in tier one and tier two cities, because they're able
Right.
to now get a far higher quality of care, digital care, than before. I think the second factor which you mentioned in terms of, as digital health will become more and more mainstream as we go forward, it is of course, exceptionally important, given that we are in the health tech space and health space in general, that these platforms develop a sort of a trust with the community of users. And that's of course taken time, because traditionally people in India especially, we've not been very used to, whether this be the adoption from the doctor side or the partner side, insurance and so on and so forth, not very well sort of entrenched along with a digital solution. But now that's fast changing, whether you look at, other platforms, could be, 1mg, PharmEasy, or mfine, and so on and so forth. I think including ours, the adoption and the trust in those platforms to be able to do what they're doing, I think it's increasing, and that is reflected in especially the adoption and engagement KPIs that all of us are able to see during these last 10 to 12 weeks. I think specifically in our case, of course, that there is a level of awareness and education that an individual needs, because when we talk of self blood glucose monitoring, Payaswani, it's to be self monitoring the individual at home. So you can't, unfortunately, compare the readings that come out of a self blood glucose monitor to a venous blood that is taken and diagnosed in a lab. So typically, there is a variance, and there will always be, unfortunately, about plus minus 15% to a lab reading that one would get. More important, I think, for an individual who's monitoring their sugar levels, it's important to treat it, and we are diabetic ourselves. Self blood glucose monitoring is to be treated something like a pre-board, right? So all of us are given boards, and your HbA1c test, which one would get, after 3 months or 6 months, is like a board exam. So fair to say that if your pre-boards are not moving in the right direction, your board exam, unfortunately, it will be difficult to score well in the board exam as well. So I think for an individual to sit at home, especially during these times, remote monitor, involve himself or herself in self-care, it becomes extremely important to adopt technologies which allow you to do that. And we've seen that happen over the last 3 years, and now over the last 2 months, we find that a significant amount of trust and adoption is already building into the platform, and we're excited, very excited about the future.
All right, Gautam, I'll leave it at that. Thank you for taking us through the experience and trends that have emerged as a result of COVID-19 lockdown. And here's hoping that we see better adoption of technologies like yours to keep people's blood glucose levels and other parameters in check. Thank you for joining us here on
Thank you,
BloombergQuint.
Payaswini. Appreciate it. Stay safe.